Hello, I'm Dr. Healthy Living, and today we're going to clear up one of the most confusing questions about blood pressure, a question that millions of people get wrong, and that mistake can quietly damage your heart, brain, and kidneys. When you measure your blood pressure, you see two numbers. For example, 120/80. But which one actually matters more? Which number is truly dangerous? The top number, systolic, or the bottom number, diastolic? Most people focus on the wrong one, and that can be a serious mistake. Today, I'll explain what each number really means, which number is more dangerous depending on your age, when high blood pressure becomes an emergency, and how to protect your arteries naturally. Let's begin. What do the two blood pressure numbers mean? Blood pressure is written as systolic over diastolic. Systolic pressure, the top number, measures the pressure in your arteries when your heart beats and pumps blood. Diastolic pressure, the bottom number, measures the pressure when your heart relaxes between beats. In simple terms, systolic equals pressure during action. Diastolic equals pressure during rest. Both are important, but they do not carry the same risk at every stage of life. Which number is more dangerous? Here's the truth most people don't hear. After age 50, systolic pressure is usually more dangerous than diastolic. As we age, our arteries naturally become stiffer. When arteries lose flexibility, systolic pressure rises, even if diastolic stays normal. This is why many older adults have readings like 150/80, 160/85. They may think, my bottom number is fine, so I'm okay. But that high systolic pressure is silently damaging blood vessels every single day. High systolic pressure increases the risk of heart attacks, strokes, aortic aneurysms, kidney disease, cognitive decline, and dementia. In fact, studies show systolic pressure is the strongest predictor of cardiovascular death in adults over 50. When is diastolic pressure dangerous? Now, let's talk about the diastolic number. High diastolic pressure is more common and more dangerous in younger adults, usually under 50.
Why?
Because elevated diastolic pressure means your arteries are under constant tension, even when the heart is resting. A diastolic pressure above 90 can reduce blood flow to the heart muscle, increase the risk of heart failure, promote thickening of the heart walls. Very low diastolic pressure can also be dangerous. If your diastolic drops below 60, especially in older adults, it may cause dizziness, falls, reduced blood flow to the brain, increased risk of heart events. So yes, diastolic pressure matters, but its danger depends on context. The most dangerous situation, pulse pressure. There's another number doctors worry about, and most patients have never heard of it. It's called pulse pressure. Pulse pressure equals systolic minus diastolic. Example: 160/70 equals pulse pressure of 90. A pulse pressure above 60 suggests severe arterial stiffness, which dramatically raises the risk of
Stroke,
heart failure, sudden cardiac death. This is why a reading like 160/70 can be more dangerous than 140/90. When is blood pressure an emergency? Seek immediate medical attention if systolic is 180 or higher, diastolic is 120 or higher, especially if accompanied by
chest pain,
shortness of breath, severe headache, vision changes, confusion. This is called a hypertensive crisis and can cause organ damage within hours. Why high blood pressure is so dangerous? High blood pressure is often called the silent killer because you can feel perfectly fine while damage is happening inside. Over time, it tears the inner lining of arteries, accelerates plaque buildup, forces the heart to work harder, weakens blood vessels in the brain. By the time symptoms appear, damage is often advanced. How to protect your blood pressure naturally. Here are evidence-based strategies that truly help. Reduce sodium, especially processed foods. Increase potassium, leafy greens, beans, avocado. Walk 30 minutes daily. It lowers systolic pressure significantly. Improve sleep quality. Poor sleep raises both numbers. Manage stress. Chronic cortisol stiffens arteries. Stay hydrated. Dehydration raises systolic pressure. And always measure blood pressure correctly. Sit quietly for 5 minutes. Feet flat on the floor. Arm at heart level. No caffeine or smoking beforehand. Final takeaway. So, which blood pressure number is more dangerous? It depends on your age and your arteries. Under 50, diastolic often matters more. Over 50, systolic is usually the real threat. Large gap between numbers equals higher risk. Don't ignore a high top number just because the bottom looks normal. Your arteries remember every spike. If you found this helpful, subscribe for more science-based health guidance. This is Dr. Healthy Living, helping you protect your heart, one decision at a time.